Welcome everyone to our Primetime Alive presentation, Love the Skin You're In, Diabetes and Wound Care. I'm Vicki Newell and I manage the Primetime Alive program here at Mary Greeley Medical Center. As a reminder, if you would like more information about Primetime Alive or how to join, you can go to our website, mgmc.org/PTA. Our presenter today is Mary Lynn Papin. Mary Lynn is a nurse practitioner specializing in wound care. She is certified in wound and hyperbaric medicine and has 13 years of wound care experience and 3 years of hyperbaric oxygen experience. Last May, Mary Lynn joined Mary Greeley's wound care clinic as their wound ostomy nurse. And you may also recognize her in the latest edition of Health Connect. She, along with the wound care clinic and the hyperbaric oxygen treatment program, are featured in this issue. It's very interesting. After today, you'll probably want to get out there and read it. So please welcome Mary Lynn.
Thank you, Vicki. I'm excited to be here with you today, and I'm passionate about diabetes, and I'm passionate about wounds, and the two can, as you'll learn today, go hand in hand. And one of my main objectives for today is to set you up to avoid a serious foot ulcer, and then second, to help you identify one early enough and know where to go for help. Okay? So, every 30 seconds, somewhere in the world, a person loses a lower limb to amputation because of diabetes. Just going to say that one more time because that's a pretty staggering statistic. This isn't just a problem in the United States, it's a worldwide problem. Every 30 seconds, a person somewhere in the world is losing part or all of their limb due to diabetes. So our second take home is no minor wound on a diabetic. They're all to be considered a serious wound. There is no such thing as a minor wound on the foot of a diabetic, okay? So in general, in the United States, this data is a few years old, so the numbers are higher than they were at the time, but the population in the United States that are diabetic is more than 10%. Among people age 65 or older, more than 25% have diabetes. Diabetic foot ulcers are one of the most popular, or one of the most common, complications of diabetes. While there are many complications, foot ulcers are quite common. Of those that develop on the foot, there is a 50-50 chance that that person will get a limb-threatening infection. A diabetic patient doesn't have the same ability to fight an infection. So it's not comparing apples to apples when you look at a wound on the foot of a non-diabetic and a wound on the foot of a diabetic because of their decreased ability to fight those infections. Of those that develop a limb-threatening infection, 20% will require amputation. And honestly, before I started in this field, I always felt like amputations happened somewhere else. But it was eye-opening, and it still is to this day, the number of people in our communities that are walking around with part of their foot missing because of diabetes. That's what I'd like to help you avoid in today's presentation. Once a person undergoes amputation, they have a 70% chance of dying within 5 years. So while the amputation is life-saving, it doesn't come without its own risks. 85% of all amputations are preceded by a foot ulcer. 60% of non-traumatic lower limb amputations occur in people with diabetes. Again, there's my reminder that every 30 seconds, somewhere in the world, somebody is losing a limb to amputation because of diabetes. Why are the feet more at risk? That's a common question, one I had and one that I answer on a daily basis for people. Diabetes causes damage to the nerves and the blood vessels that run down the legs and into the feet. Usually diabetics also suffer with high cholesterol and high blood pressure. Those, together with diabetes, cause a considerable amount of damage to the arterial blood vessels. Those are the vessels just carrying the blood from your heart down to your feet. So a diabetic patient has decreased blood flow to their foot. They also have decreased nerve function to their foot, which is also caused by diabetes as it damages the nerves. The nerves are also responsible for bringing oil and moisturizers to the skin. So it's very, very common that in the diabetic foot, you'll see a lot of dryness, cracking, and callus formation. Callus formation is something that I want you to remember at the end of today's presentation because it's something that we should watch for on our feet, and we're going to learn how often we should check a diabetic foot and what we should be looking for. Okay, so we'll be coming back to calluses. The reason calluses are a problem is because that tissue is it's just hard. It's like a rock, and it's on the bottom of the foot. So with every step that person is taking, it's as if they have a pebble in their shoe, and that pebble or callus is pushing into the deeper, soft tissues of the foot. It's not uncommon at all when a callus is removed from a diabetic foot to find an ulcer hidden underneath the callus. We talked about the injury to the nerves. That's called neuropathy. If your doctor tells you that you have neuropathy, that means that you have either lost all of the sensation or part of the sensation to part of your body. In diabetics, that's most common in the feet and also in the hands. With this decreased sensation, a diabetic can step on a piece of glass, a screw, a nail, a piece of metal, a piece of wood, a dollhouse chair, a car key. I've removed a lot of different objects from the feet of my diabetic patients. And it's kind of hard to imagine, unless you see it, that the nerves could be damaged to the point where you literally would not feel stepping on such a sharp object. But it's a daily reality, and that's why we need to check the diabetic foot daily. So we'll be coming back to that as well. Along with this loss of feeling to the feet, many people with diabetes also have vision problems. So it is a primary role of the diabetic patient to check their feet daily, and part of checking is with the eyes. Another part of checking is with the hands. So a lot of my diabetic patients find that they do quite well if they have somebody who can check their feet for them. And we'll go through how to do that, okay? Prevention, 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 right? It's everywhere in healthcare. It also applies to the diabetic foot. The best way to prevent a diabetic foot ulcer, which can often lead to serious complications, can lead to loss of limb, is to take good care of your feet. This includes a daily check. So when you check your foot, you're looking and feeling for blisters, calluses, redness, chafing. It would be red and look like maybe your shoe was rubbing on that area. Most people need to use a mirror to assist them. So some people do this by propping the mirror up on the foot of their bed and sitting in a chair and propping their foot on the end of the bed right by the mirror so that they can see the bottom of their foot and spread their toes. If you do have the flexibility, it's good to look in between each toe as well, okay? You're primarily looking and feeling. So it is important to have your primary care provider perform a foot check on you at your annual visit. When you go in for your annual checkup with your primary care provider, your family doctor, ask them, if they don't, just ask them to do a diabetic foot check on you, okay? That is an important time when problems can often be found, and it's best to do the check right after you've taken your shoes off. So if there are red spots that are pressure points from your shoes, that they haven't gone away before you or somebody is able to look at your foot. I want to say here that on the foot exam, if you find any of the following, if you find a blister, if you find a reddened area, if you find calluses, if you find an area that's warm to touch, or if you find any changes in the bony structure of your foot, maybe your toes used to lay flat, but now they're kind of curled up, or maybe the arch of your foot has changed. Anywhere that there's a bony change in the foot, in addition to the other things that we talked about looking for, you want to go see your primary care provider and have them look at it. And they may refer you to a podiatrist, and they may refer you to our wound healing clinic, which also has podiatrists that see wound care patients. So, daily use of a moisturizer, something simple. You're not looking for the expensive Bath and Body Works with a lot of scent. You're looking for, Gold Bond makes a nice one for diabetic feet. There's a generic version of that. Vanna cream is nice. It's just very plain, very hypoallergenic. You can use whatever lotion you have is better than none, but applying it to those areas where there are callus or thick areas of dry skin can help. Never, never, never apply any lotion between your toes. It's very important for the diabetic foot to stay free of moisture between the toes. It can lead to skin breakdown, which would then be a wound, and it can lead to fungal yeast infections, which can really take off and become a problem on their own. Wearing proper footwear. Really can't say this enough. It used to be that proper footwear was pretty ugly. It looked pretty medical, pretty orthopedic, but there are really nice looking diabetic shoes out there now. A brand that I write prescriptions for many of my patients is Dr. Comfort. There are places in town. Medicap is one of them where you can go and look through the catalog, see their shoes, and they can size your foot and custom mold the footbed. But if you have any of the areas that we were talking about, like redness or calluses or the chafing from a shoe or warmth or bony changes, you really need to see a foot doctor first before you go get your new shoes. But as a diabetic, if you are on Medicare, Medicare will cover 1 pair of diabetic shoes per year and 3 custom insoles per year. The diabetic shoe is shaped differently, and that's with the goal of protecting the diabetic foot. So the toe of the shoe is not pointy. You do not want to wear pointy-toed shoes. And even some of them that are rounded, they're just too narrow. They're just not wide enough in that toe box, the part of the shoe where the toes sit. So a diabetic shoe, the toe box is wide enough so the toes are not being pressed upon by the shoe, especially over bones, because there's not much tissue there. So it doesn't take long to break that skin down, and then you have exposed bone, which could lead to bone infection and amputation. So diabetic shoes offer a safer option for your toes. They also offer a deeper footbed, and that helps to protect from rubbing on wrong areas. And if your podiatrist has made a special orthotic insole for your shoes, a diabetic shoe is going to accommodate that insole. It'll fit in there so much better. If you've tried them before, it's hard to find shoes that you can put it in and the foot isn't sitting up too high. So then everything's hitting in the wrong spot, especially the tops of your toes. So the diabetic shoe will allow space for that. And there's a lot of cute styles now and handsome ones. So I highly recommend them. Inspecting your shoes every day. This is an important part. So again, you're inspecting with your eyes, but you're also inspecting with your hands. So you're looking in your shoe for areas where it's excessively worn compared to the rest of the shoe. And then line that up with where that is on your foot. Oh, that's the top of my 4th toe, or oh, that's my heel, things like that. You need to inspect them and also you'll feel an indentation where a shoe is being worn out prematurely. Because of the bony part of the foot, pressing into the foam or leather or fabric, okay? So very important to check that. Also, while we're talking about shoes, diabetic people should really always wear shoes at home. And for some people, this is a tough one. They were raised to not wear shoes in the house. In those cases, I advise them, if they're able to get 1 pair of shoes that are their house shoes. And this would be, a good supportive shoe, not what we think of typically when somebody says house shoes, we think of a slipper. Because the proper fit and the stability that it offers you is highly beneficial, but then 2, that hard bottom, if you do step on a piece of glass in the kitchen or metal shaving in the workshop or a car key, I've seen all kinds of things. It won't hurt your foot because you have that shoe on, okay? And what people often do to try and protect their foot from an area of pressure where you're getting a red area over a bone on a diabetic foot is they'll wear a shoe that's too big for them. Well, that can come with its own problems. We discussed looking for areas of chafing or friction, and that comes from just too much movement of your shoe of your foot within the shoe. So that can cause a diabetic foot ulcer just as easily as a shoe that's too small. So one really nice benefit of going and getting a diabetic shoe is you're going somewhere where people are trained to help fit it. But if you are looking at your shoes you have at home and you're wondering if they fit good, you should have 1 thumb width between the end of your big toe and the end of the shoe, okay? Any more, you'll be sliding around in there too much. Diabetic socks. A lot of people forget about these, but they're wonderful because they're made without rough seams on the inside. On the diabetic foot that has nerve damage, you wouldn't feel that rough seam, and they can cause injury. So a diabetic sock is going to protect you from that. You don't even have to think about it. And also the top of the sock that's often too tight and leaves an indentation in our legs, the diabetic sock won't do that. It's woven differently to prevent that indentation that can have kind of a tourniquet-like effect on your blood vessels. And in the diabetic foot, you don't want to do anything that's impeding the blood flow to your foot. You can get these at Walmart, Walgreens. They're all over online, but a lot of stores have them now. So washing your feet daily is important. You don't want to soak them. Because we learned about the nerve damage causing a drying of the skin, you don't want to dry them out more by soaking them. And you don't want to soak them in a foot bath with oil in it either. That's not safe because that'll get in between your toes and you'll have a skin issue there. Okay, so just washing them with mild soap and water, rinsing them well, and using a towel to pat your feet dry, and being sure to get in between each toe is important. If there is a callus, just gently rubbing that wet callus with the towel even is helpful before you apply the lotion to that callus. Speaking of callus, I should definitely advise not to use instruments to remove callus on a diabetic foot. I've seen people use, like just a pumice stone, the paring tools that are sold like in the pedicure section of a drugstore. One little slip, just a little too far, can lead to an ulcer that's difficult to heal or may not heal at all. So you're really needing to go see your family doctor and your podiatrist to get help with that. And for all you farmers out there, don't go to the tool shed. I've seen a lot of that. Very handy with tools, and while they are effective, your skin can't take them. And then you'll be seeing me and telling me about what you used on your foot, and I'd rather have you to not have to come see me. So, keeping your toenails clipped. This is an important part of diabetic foot care, but we do advise many people to get help with this. If your vision isn't good, or you have really no sensation in your feet, you should get help. But otherwise, you're just looking to cut that toenail straight across. You don't want to cut down the sides. Ingrown toenails on a diabetic patient can become a diabetic foot ulcer, and they get infected very easily. And that infection can move up the leg quickly, requiring hospitalization and sometimes amputation. So ingrown toenails are no small thing. If you do cut yourself or you develop an ingrown toenail, go see your primary care provider right away. And I really can't stress the right away enough, because in a diabetic foot, things progress much more quickly. And The reason people put it off is because you're used to healing and you never expect that there'll be a time when you won't heal. But when it does happen, it happens really quick. And then it takes up a large amount of your time and energy working on getting that healed. So seeking care early is definitely key. Managing your diabetes, 100% needs to happen for many reasons. If you do have an ulcer, it'll help your ulcer heal much faster. Managing your diabetes will help protect your blood vessels and your nerves from further damage. It's not a guarantee, but it definitely changes the rate at which you have damage. If you do smoke and you're diabetic, I would definitely encourage you to reach out to your doctor and get help with quitting. Iowa has a quit program, and your doctor will have all these resources. I've been a smoker. I know how hard it is to quit, but the impact on a diabetic's blood vessels is very destructive, and just quitting will make such a huge difference in your ability to maintain good blood vessels and your ability to heal if you do get a wound. Getting regular, gentle exercise is also really good for your blood vessels, so walking or riding a bicycle, things like that. Okay, so we've talked about timely treatment. If despite your best efforts, you develop a sore on your foot, we really want to see you, okay? It's what we do, it's what we enjoy. We're a clinic that's staffed with general surgeons, podiatrists, nurses that are wound certified, and myself, a nurse practitioner. So we'd rather see you sooner than later, and taking care of wounds is what we love. So we don't want you to hesitate to go see your doctor and ask them, do you think I should go to the wound clinic? And your doctor will know if you should. But you can come to the wound clinic also without a referral, okay? You can call and just make an appointment. Here's my reminder again at the bottom of this slide. If you have diabetes, there is no such thing as a minor foot wound. So what is a wound care center? Well, here at Mary Greeley, we have one. And oftentimes, wound care centers are known as the best kept secret. And it's because when you need us, you really need us, and we love being there for you. But if you don't need us, you don't necessarily know that we're there. But knowing that we're here, you can also be a better help to your friends, family, and neighbors. So we specialize in treating wounds that are difficult to heal, okay? We use advanced dressings. There's new technology coming out every year in wound care, and we stay up to date with these, and we employ them in your care to heal you the quickest way we can. The longer you have an opening in your skin, the greater your risk of infection. So our goal is to always be aggressive in your wound healing and get you back to your life. Many wound care centers, including Mary Greeley's now, have hyperbaric oxygen therapy. Hyperbaric oxygen therapy is a wonderful adjunctive tool in healing the ulcer on a diabetic foot. It's one of the most exciting things about my job. I love to see a wound heal, and the 100% oxygenated environment. Let me see if we have a picture. I don't think I have one on here. It's a chamber, and it kind of looks like a glass tube, okay? And when the patients are in there, they're laying down and watching TV. And they are in a 100% oxygen environment that is also pressurized. We use terms like diving because it's based on the dive tables that the US Navy developed. So you are generally going 2 to 2.5 times atmospheric pressure when you are in the chamber. You're not actually moving, but the environment that you're in is compressed as if you were deep sea diving, okay? Otherwise, you've got clear glass and a little flat screen TV there to keep you entertained and comfortable while you're in there, and our attendant is by your side at all times. The reason hyperbaric oxygen therapy is so healing to difficult to heal wounds, many wounds don't qualify, and even a diabetic wound has to be considered bad enough to go into the hyperbaric chamber. The reason the hyperbaric chamber is so effective at healing that diabetic foot ulcer is multifold. One reason is if the ulcer is infected, the hyperbaric oxygen helps the antibiotic to get into those tissues better. You get better blood flow, better oxygen delivery, and the blood carries the antibiotic to the site where it's needed. Another reason is in a hyperbaric chamber, you can actually grow new blood vessels. It's called angiogenesis. And in the foot of a diabetic, as we talked about earlier, those blood vessels can often be damaged. So before we put somebody in a hyperbaric chamber, we check their blood flow, and we have other interventions that we use in our system here. Dr. Golchin, our interventional radiologist, if he can fix some blood flow issues, we get him on board. And we optimize everything that we can for the diabetic patient with an ulcer on their foot, because we don't treat just the hole in the foot. We treat the whole patient. So we'll be having you work with diabetic education and your primary care provider or your endocrinologist who's ever managing your blood sugars, and working with someone like Dr. Golchin to optimize your blood flow, working with surgeons when needed. And then we put you in the hyperbaric chamber, and you get the benefits of new blood vessel growth, increased oxygenation. With that blood flow come all the cells that we need to heal a wound. And in that environment, we're often able to heal wounds that otherwise would not heal. So it's very exciting to have it here at Mary Greeley, and it was the reason I wanted to come here and work. I've wanted to serve at Mary Greeley. I was just waiting for hyperbaric oxygen therapy. It's a tremendous tool for our communities and the people that we serve. Oh, here's a picture of the chamber. Okay, so that's exactly what ours look like. And in the picture, the nurse or technician that is running the hyperbaric chamber is speaking on a telephone to the patient. So you are able to communicate, and they're close by, which makes for a comforting environment. You're breathing 100% oxygen. At room environment, you're breathing about 20% oxygen, if that gives you an idea. Plus, like we talked about, it's pressurized to 2 to 2.5 times greater than our atmospheric pressure at sea level. Hyperbaric simply means high pressure, and you're getting a high pressure, high dose of oxygen. That's what's going to help you fight infections and heal your wound. Our wound care team here at Mary Greeley Medical Center all have advanced training in wound healing and advanced training in hyperbaric medicine. We are experts in our area, and we cheerfully do our job. We feel privileged to take care of people that have wounds that are difficult to heal and embrace the challenge and the opportunity to be part of your care team. Annette at our front desk, she would assist you when you call and get everything coordinated for you. So all you really have to do is make the call. Here's our phone number, 515-956-2979, or you can find it on the website, or you can just call the main Mary Greeley number. Now, I would like to show you a foot check card. And Vicki has already sent you the attachments for both today's PowerPoint presentation and for this foot check card. And I think this foot check card would be something very nice for you to print and have in your bathroom or on the back of your bedroom door somewhere as a reminder, because it's really easy to forget and it's hard for us to build new habits. But they say if you do something for 21 days consistently, you build a new habit in your brain, and then it does start to become easier. But this can make all the difference in your quality of life now and in the future. So we talked about neuropathy, and that's where you have decreased feeling in the feet because of the nerve damage, okay? So you're inspecting your foot daily for any foreign object that could be in there, okay? Neuropathy, it often feels at first like numbness or tingling. It can feel like a burning pain. It can feel like electrical shock-like pain. The foot can be extremely sensitive to touch. So if your foot didn't used to be extremely sensitive to touch, that alone can be a symptom of neuropathy developing. Patients also describe it as feeling as though they're wearing a glove or a sock when they in fact are not. So if you have any of those symptoms, go see your family provider, your primary care provider, and tell them about those symptoms, because there are things that can be done early to help protect you from it getting worse. Getting your regular checkups, regular exercise like we discussed. Okay, inspecting your feet daily. You're looking for red spots, areas of warmth. If you have red streaking running up your leg, that's not really go to your family doctor or the wound care center. That's go to the emergency department. If you are finding swelling, cracks, sores, any foreign object, don't try to take it out at home. Go to your doctor and have them work on it, or the emergency department. If you're getting those sensations we talked about, burning, tingling, numbness, any of those other sensations, go see your doctor and tell them. Sometimes that's how people find out they're diabetic. Wash your feet in lukewarm water with mild soap and water, rinsing well, patting dry with a clean towel, and being sure to dry thoroughly in between your toes. Putting moisturizing lotion to those areas of thickened, dry skin and calluses to help soften those areas. Wearing proper footwear. Can't say enough about that. Never walk around at home barefoot. Do not wear tight or uncomfortable shoes or pointy-toed shoes. Make sure that your shoes and your socks fit properly. And avoid open-toed shoes and open heels and that pointy, narrow-toed shoe like we discussed. So that's my presentation for you today. So I want you to remember, every 30 seconds, somewhere in the world, a person with diabetes is losing part of a limb to amputation, and that on the diabetic foot, there's no such thing as a minor wound, and check your feet daily. Thank you.
In Tim's opening, there is a question. I think you can see it there. If you'll read the question and then answer.
If a person is not referred to the wound clinic by the primary care doctor, but makes an appointment directly, do you know if Medicare will cover it? My understanding is yes, but we should double check that and get back to them.
I can email that out.
You can email that out?
Yeah.
We'll double check it to be sure. And one word of warning, Medicare versus Medicare replacement plans, they have different rules. So when in doubt, call. But we'll, Vicki said she'll get that out to you. Thank you for the question.
And I can close it, but we can watch to see if anyone
Okay.
come up.
Thank you.
All right, as of right now, actually we had another question pop up. So we'll let you jump back in here, Mary Lynn. And if anybody else has questions, get them in there now for Mary Lynn.
I have toenail fungus. Yes, that's common, especially for us Midwesterners. It's in our soil. Can that be a problem? How to treat? Yes, it can be a problem. Depending on how severe it is, I would recommend going to see your doctor first, but depending on how severe it is, they would probably want you to see a podiatrist. We don't specifically treat just toenail fungus. Somebody has to have a wound to come to our clinic, but we have excellent podiatrists who would be able to help you treat that. But most importantly, I can say keep your nails trimmed, like we discussed, straight across, not rounded or angled on the corners, and watch for spreading. It's kind of an interesting thing that we see very common is, when we're sleeping at night, we don't realize we're using our toenails to scratch our other leg. And we see people get cellulitis, an infection of the skin, from that fungal nail scratching the leg. So just keeping that in mind. There are over-the-counter preparations that they will work, but you have to apply them every single day. You can't miss it. And you have to apply them to the area where the skin meets the nail. Most people tend to want to apply it out here at the end of the nail, but it has to be applied here. And you have to be really faithful for that to work. There are pills, they're harder on the body, so we're not too quick to prescribe those. Also, if it's bad enough, a very effective treatment is the podiatrist will remove the toenail, which sounds extreme, but it can be a really great solution to a bad fungal toenail issue.
All right. Wonderful. Well, thank you, Mary Lynn. Great presentation. And great article. I had read that a couple days ago about the wound clinic in the Health Connect magazine, and so it's amazing what you guys can do. So thank you for the time you put into putting together your presentation and for giving the presentation today. I want to remind everyone of our upcoming programs. Our next one is Tuesday, June 8th at 2 o'clock, virtually again, and it kind of piggybacks on this. One of our physical therapists is talking about foot health, more so from the foot perspective and different things that he can guide you on, and he's done this for us before. It is a great presentation and won't necessarily repeat, but will complement what was talked about today. And then Wednesday, June 16th, we have a program, The Aging Brain Prevention is the Best Medicine, and that's Dr. Selden Spencer with McFarland Clinic Neurology. So thank you for joining us, everyone. Have a great day.